There's three medications that when a patient goes on hospice, the hospice provider sends out, and it's usually within that first 12-hour period that the patient is brought onto services. And in some instances, they move pretty quick depending on the company and the situation at hand. So those three medications, the first one is Ativan, also called LORAZEPAM, and it is for anxiety. The second one is morphine, which the largest myth surrounds, which is hospice just comes in and they start pumping patients full of morphine and they kill them. Absolutely not. If you've experienced that, you should not have, okay? Morphine basically is administered to help ease the pain when the body is already beginning to shut down, just so the patient can pass with a little less pain. And the goal is always to have them pain-free. The third medication is PROMETHAZINE or Phenergan. It's the same thing. It's usually going to come in a suppository form, and it's for nausea. These medications aren't always given right off the bat. They're given when the patient needs them. And I've seen patients historically that needed Ativan routinely, and I've seen others that did need a little bit of morphine because their pain could not be managed depending on what disease they were dealing with. A lot of my cancer patients preferred morphine because it would help knock that edge off, if you will. Their words, not mine. And so those are the three medications. A lot of hospice companies are going to call them like a comfort pack, and they'll send them out in like a box to where they're all the same with a nice little explanation. But it's always important that you hear from someone that especially has had to do end of life what those medications actually are and what we're supposed to be doing with them.